I have bad acne. I
Okay.
used to have very bad acne, and we never had a good dermatologist in our town where we
Okay.
stayed, and we never had a good. So we used to go around looking for skin people, skin experts. We won't call them doctors; they're skin experts, and
Right.
they were mostly in these beauty parlors and all.
Right.
So my acne was actually very severe. I had back acne, I had face acne, and we tried topical creams, everything, homeopathy, nothing worked. So this is how low we had to go. We went to the skin expert, and she told us to use seabed. You know, the sand from the seabed.
Oh.
Mix it up with water. It's a smelly thing. Mix it up with water. Pour it on your face. Pour it on your back. Put it on your chest. Keep it there for half an hour. Make sure the room stinks to God knows high.
Right.
And it never worked.
Okay. So apart from the most common dermatological problem which every person goes through their adolescence, teen, and at this age group is something called as acne.
Yes, yes, yes.
So what is acne? Why does acne happen?
Acne is purely related to one's hormones.
Okay.
When you're born till your prepubertal age, you are having the best skin known to mankind. Your skin is smooth, it's shiny, it's glowing. But then, unfortunately, your hormones start setting in, your testosterone, your estrogen, everything. They come in and they make a mess. And we have glands in the skin called sebaceous glands. These glands produce oil. And what happens is when these hormones start going haywire, it causes these glands to get clogged because they produce oil, and sometimes these glands, they get blocked. And when they get blocked, the oil collects in the glands and they get bigger and bigger, and they get inflamed, they become red, and that's why you see them as little bumps on the face, on the back. And so it's acne is it's related to the age. It starts from your teens. It can go all the way up to your mid-30s. There are a lot of factors that contribute to this. Diet,
Right.
stress, and as we mentioned earlier, hormones, family history.
Okay.
Now, acne, there are varieties of acne. I'm not talking about the types. I'm talking about types of acne according to its location.
Okay.
You have acne on the face. This is what everyone has. Most people have acne on the face, but there are people who have acne on the scalp. They have acne on the back of the neck, their back, their chest, their thighs, their groin area, their armpits. So it comes in all shapes and sizes and forms. And that's a very frustrating disease. It affects a person's self-esteem,
Yes.
his image, his self-worth. And fortunately, medicine today has found very good solutions to permanently deal with acne.
Okay.
So it was not like before where doctors used to say, this is part of life, live with it.
Right.
Yeah,
It will come down.
It will come down later on. No. Now we have the science to say that we can stop it right then and there with some very good medications out there.
So when when they are in their teens or when they are in their mid-30s, when should they approach you for acne treatment?
The sooner the better.
So there is no age.
There is no age. The sooner the better. You come and show a dermatologist, the sooner the better. Because what happens is acne has its post complications. Everything has a burnout period.
Okay.
Acne has a burnout period. After some 10 years or something, you'll be done with the thing. But what it leaves behind, it's scars. Lots and lots of scars. Your face was not the same smooth face that it was when it was a child. It's become a coffee cake. So you have to address it before it goes to that point.
Okay.
So the sooner you show to a dermatologist, he will assess you. He will give you the right medication. He will give you the right skin regimen to follow, the diet. So visit a dermatologist if you don't want to go into that complication.
So before, what I understood, or my understanding about acne is an infected,
Yes.
infected boil.
Mm.
So there was a trend on taking antibiotics, buying antibiotic creams over the counter.
Yes, yes.
What is your suggestion, or what is the current regimen?
See, the thing is, it was never considered an infection.
Okay.
Acne, that should be something that people should learn right now. Acne is not an infection, it is an inflammation.
Okay.
The problem here is you have a very hyperactive sebaceous gland that produces the pimple. And once the oils start depositing in that gland, it's an excellent culture medium for certain bacteria. Now, this is not bacteria that is an infective bacteria. This is our own natural skin growing bacteria. They multiply extensively and they cause our body's inherent reaction,
Okay.
which causes this inflammation to increase and becomes a pimple.
Okay.
So antibiotics are not meant to just control the bacteria. It is meant to reduce the inflammation.
Okay.
Okay. So whatever antibiotics I'm giving to the patient, they are not meant to treat the to treat the bacteria, to treat the inflammation, to suppress it.
Okay.
Antibiotic creams are now being used less.
Okay.
Not many doctors are prescribing antibiotic creams. We are moving away from that. We are more focusing towards creams that reduce the inflammation. For example, retinoid creams, tretinoin.
Okay.
That's an over-the-counter anti-acne cream. It's safe. Most of us are now using that. We've stopped going through those areas now.
I see. So now if you have maybe 2 pimples, 3 pimples, do I visit you, or is there something more than this? That's when I come and visit you.
Nothing like that. You come and see me even if it is one pimple. Okay. So why I'm saying
no, because
this
if we know that the acne is going to reduce in time, I agree that there can be scars, but scar is something when you try to break the. I don't know whether I'm right.
No.
If you break the pimple, it may cause a scar. If you leave it alone, the skin self heals. So, what is your suggestion?
So I would like to disagree with that because wounds heal, scars remain.
Okay.
That's a cliched proverb, but it's very true. You should pimples. The problem is it leaves behind the damage it has caused.
Okay.
So that's why even if it's 2 or 3 pimples, I would recommend you to see a dermatologist and have them assess you, and be able to give you the ideal regimen that is fit for your skin type, so that you don't go into those complications.
Can you give a small idea on what is this secret regimen you're talking about?
There is no secret regimen. We assess based on the grade of your acne.
Okay.
So we have 4 grades. Grade 1 is where you just have the tiny little blackheads, the comedones. Grade 2 is where you have comedones and those little bumps we call the papules. Grade 3 is where you have the blackheads, the papules, and the pustules. And grade 4 is the most severe type where you have the cysts and nodules, really bumps with cysts, pus just coming out like that. Those type of very severe type of acne grade 4. Yeah. So we see you, we analyze you. And if you have mild acne, which is grade 1 to grade 2, probably you just need a topical anti-acne medication, topical anti-acne medication. Usually around grade 3, you'll need to take oral medications. Okay. We usually start with antibiotics. But if the antibiotics do not give the satisfactory results, or if you have very severe grade type of acne, which is grade 4, we switch you to the last line defense against acne, which we call isotretinoin.
Okay. Okay. So now, suppose if a person is already, now currently we see a lot of people with already scarred faces post acne.
Yes.
Can it be treated now?
Yes, we can. The science has advanced so far to improve acne scars. There are a multitude of procedures for that. So the first procedure ever done was called microneedling. where you use these tiny little needles, which it's a cylinder with a lot of needles projecting out of it, and you just roll it on your face. And what happens is it creates these micro tears in the skin, and bleeds occur under the skin. So it releases platelets. Now these platelets contain something called growth factors, which causes a reconstruction or remodeling of the skin from within. So your skin gets smoothened out. That is microneedling. That was what we did earlier. Then there came dermabrasion. Then you have peels. And now microneedling, they've combined with another energy source called radio frequency. So we have called radio frequency microneedling, where we use multiple needles uh, pierce your skin, and when it pierces the skin at a certain level, it releases a heat energy, a radio frequency energy, and this causes damage of the surrounding tissue area under the skin, not outside, under the skin. And this causes the release of growth factors, and these growth factors are essential for remodeling the skin. Then, of course, if you have a deep, like a sunken skin, some people have there who had really bad acne where they have a lot of puckered holes and all that. So there we give fillers to level out the skin. Now the issue about acne scars is something of the ancients. Now we have very much advanced,
good advanced
we have
techniques.
advanced technologies to make the skin nice and smooth.
Okay. So, what is the average duration a patient should consider undergoing the acne treatment if they're in grade 4 or grade 5?
You mean the severe acne?
Severe acne.
So it depends, Usually, if I'm going, like I said, when you go to level of grade 4 severe nodule cystic acne, you will be needed to be started on isotretinoin. The average duration of treatment goes up to 6 months.
Okay.
But it depends on the doctor's expertise. Usually, we don't just look at the time duration, we also look at the response. If we're seeing an adequate response, then we stop. But there are a lot of parameters that we decide on when to stop. But the average duration will be not less than 6 months. Not less than 6 months.
Is there a chance of recurrence of acne post-treatment?
Post-isotretinoin therapy? Yes. There have been I have given isotretinoin therapy to many of my patients. Till now, touch wood, no one has had a recurrence of acne. I've had only one case that came to me where they had a recurrence of severe acne. Now, it's not as though the treatment failed. Usually, we make the patient go in for one more session of one more cycle of isotretinoin therapy.
Okay.
It's not the fault of the drug, it's part of the body.
So is it also because of the lack of proper diet, sleep, or hormonal imbalance, which can also add to a recurrence?
Nothing like that.
Nothing.
It has nothing to do with that. If your body is prone to get acne, it can recur. But it's very rare for people who have taken isotretinoin for a certain duration for them to get it again, especially a very severe form of acne. It will be much milder. If at all it recurs again, it will be much milder.
So, to what I understand is once they take this treatment, maximum 6 months, and then for a lifetime, 95% no acne.
Yes, you can say that. Almost they'll be completely devoid of the disease for a very long time, or they'll have a very mild form of the disease, which can be managed with a topical cream, a good face wash. You can manage that.
Is there any side effects to taking this?
There are side effects to this medication. That's why this is a prescription-only medication.
Okay.
Only certified dermatologists can prescribe this.
Right.
And it requires monthly follow-ups.
Okay.
We cannot give this medication to women who are planning to conceive, who are breastfeeding, who are pregnant, because these are teratogenic medications. They can harm the baby.
Okay.
We also advise the patients to, if they're married but they want to get rid of their acne, we tell them that you have to practice contraception. You have to practice contraception even 3 months after stopping the medication also.
Okay.
So this is a very high risk medication which requires certified dermatologists to be followed up with.
So is isotretinoin,
Yes,
is it a topical or a cream or is it an oral tablet?
it is a capsule.
It is a capsule.
It is a capsule which you have to take. Most we advise to take it at night, not in the daytime. The night time before
It's
bed.
once a day.
Once a day. Once a day.
Okay.
So we give it according to your body weight, and we have to make sure that you are completely fit before taking this medication. We have to make sure your liver is okay, because this medication has a lot of it can affect your liver. If you have some liver issues, it will be you will not be eligible for this. You have to look at your cholesterol,
Okay.
because this drug can also play with your cholesterol if you do not follow a proper diet. So we need to monthly follow up on that, and we need to check your bloods. It does not as much affect your blood parameters as it does at your liver and your cholesterol. And if you're a woman of childbearing age, you're married, we need to get a urine pregnancy test before starting the medication.
Okay.
And we advise the females who are in that category to practice contraception during the course.
Okay. So I think what our viewers should understand is that even though if it is over the top or over the counter, if the medicines are given, I think definitely see you, get yourself checked,
Yes,
examined,
exactly.
and
Yes.
then so that you don't have to suffer later.
So you won't have to suffer later, because it's always best to show to someone who knows that
Right.
what the skin status is. So
Because dermatology as a branch, people take it a little bit more easy and say that, okay, maybe if I can just see something on Google, see something on digital media, and because influencers influence people in
yes,
multiple ways.
yes, they do.
Does it affect your practice? Do you get a lot of problems because of influencers?
Yes, we do. The influencers are actually not doing a very good job in influencing. They're actually giving wrong information, and we have to play the role of saying, "Don't do that, don't do this." So,
Right.
And they have we have a lot of influencers on Instagram and TikTok and all those people. They promote their medications, their creams, celebrity creams, and all that. They're expensive,
Right.
and there is no active ingredient in them. If you act, because I have looked at all these ingredients and I've checked them, there's really no active ingredient in them. They're
Okay.
just basically moisturizing creams and lotions. So yeah, you should take their advice with a pinch of salt. Okay, they are not the ones who know their skin prop. They are paid.
Right.
Okay, they are signed a contract with some big lucrative company. Tells them that, okay, we put your name on that. You just say what we tell.
Right.
And the rest of the thing we'll handle. So but this is one thing that people should understand, that influencer is not the person to go for skin advice.
So not only about influencers now, as a homemaker or a small child watching TV, we see ads where there's a small pimple, you put this cream, and things. So when they go to the supermarket, they see this so-called brand is maybe $30, 40 rupees. Whereas if they come to a dermatologist, that 40 rupee cream it will not be the same, but it will be around maybe 200 or 300 rupees. So people feel that I think the doctor is cheating me, and I would prefer the 30 rupee if it's going to show the same results on the ad. So what is your suggestion?
I would take this. My suggestion is talk to the expert. Don't look at some poster ad that says that apply this paste on your face and it will disappear. I know this from personal experience, because back where I have bad acne. I used to have very bad acne, and we never had a good dermatologist in our town where we stayed, and we never had a good. So we used to go around looking for skin experts. We won't call them doctors; they're skin experts, and they were mostly in these beauty parlors and all.
Right.
So my acne was actually very severe. I had back acne, I had face acne, and we tried topical creams, everything, homeopathy, nothing worked. So this is how low we had to go. We went to the skin expert, and she told us to use seabed. The sand from the seabed.
Oh.
Mix it up with water. It's a smelly thing. Mix it up with water. Pour it on your face. Pour it on your back. Put it on your chest. Keep it there for half an hour. Make sure the room stinks to God knows high.
Right.
And it never worked.
Okay.
Okay, so but that was because we didn't have doctors to tell us
Right.
this is not what you need, this is what you need. So viewers, please be aware that you are not come to us.
Right.
We will tell you what you need. Don't look at some celebrity who tells you, I use this cup, I apply it on my face, and I use this regimen, I apply it on my face. That's
Right.
not the person you should be asking. Okay, because it's going to affect you in a long run.
So I'm very glad that you opened up about
Yeah,
your
no.
personal issue.
Yes, yes.
Because I think now if I look at your face, there's no signs of any acne.
I know. You know very well.
So I think definitely, I think you are the dermatologist
Yes.
people should see
Yes, yes.
in cases of acne.
Of course.
So I'm glad that there is treatment for permanent,
Yes.
permanent solutions to acne. So I hope our viewers get, justified and by listening to you.
No, and viewers should not have this assumption that I can tell you by sending me a photo here, I'll tell you, okay, fine, you just need this and this. You have to go personally to a doctor.
Yes.
Even you can do an online consultation also. I'm not saying that you have to go personally to the doctor. You can do an online consultation, let him assess you, and he will tell you what is the ideal treatment.
Yeah, so I agree with you, because even be it in surgical practice,
Yes.
be it as a physician, whoever, clinical examination is prior importance.
Yes.
Without clinical examination, just seeing a report, seeing a photo
Yes.
does not give us the right diagnosis.
Yes.
I think it's the feel, the visualization, the touch, which gives you a better idea to come to a accurate diagnosis.
Yes, it's true. It's true. But you were talking. What I was saying was that online is not a bad thing.
Okay.
You can do online consultation. It's there are situations where I may not be able to go see a doctor, especially a skin doctor.
Right.
Let me be honest with you. Dermatology is not an emergency.
Right.
I have a pimple today. I can live with it for the next 1 month. Okay. It's not going to harm me. Maybe when I look at myself in the mirror, I might feel a little upset about it, but it's not going to hurt me in any way. If I have an ulcer, I can't sit at home with the ulcer.
Correct.
I have to go to the physician and I have to get my ulcer checked. If I have a back pain, I can't sit at home and say I'll live with the back pain. I have to go to a physiotherapist, get my back fixed out. So if the option is there to do a preliminary assessment via an online consultation, it is not at all a bad thing to do. Go ahead, book an appointment with an online consultant. There are a lot of websites out there that promote online consultations with dermatologists.
So not only look at the website, look at the degree of the doctor too.
Look at the degree of the doctor too. Yes.